All right, this section is going to be covering mood disorders. And in this section, we're going to be covering depressive disorders, bipolar disorders. We're going to explain where mood disorders come from, and then I think we're going to get to suicide actually a little bit later. I don't remember. With mood disorders, that involves a significant change in a person's emotional state. Typically, this includes them feeling depressed or extremely elated for an extended period of time. Mood disorders are relatively common and they affect about 10% of the adult population of the US in a given year. So, again, quite common. So, depressive disorders are the most common type of mood disorders, and that involves major mood disturbances involving deep depression. There is an excellent little webcomic called Hyperbole and a Half, and if you look up that title, and then you look up Adventures in Depression, and then she also has a part two. It is a really excellent comic. It's funny, but also really gives excellent insight into what it's like to have a major depressive disorder episode. So, depressive disorders may involve depressed mood or loss of interest or pleasure in one's usual activities. It can result in changes in sleep patterns, either the person sleeping more or not being able to sleep, changes in appetite, again, either more or less than normal, and changes in motor functioning and a loss of energy. Um, it also, we see different types. There's one type called persistent depressive disorder, also known as dysthymia. This is a moderate depression, that period that persists for 2 or more years. And then we have major depressive disorder. That's a mood disorder in which a person has suffered one or more intense, and I mean very intense episodes of depression. Women generally have higher levels of depression than men, and this result is a result of three major factors. First is biological. Women are more genetically at risk for depression, and our ovarian hormones may influence our serotonin levels, making us more prone to depression. It's also psychological. Women tend to ruminate more about their problems, and then relationships are a key part of a woman's self worth. So, she's having problems with her significant other or a friend, it may impact her psychologically. And socioculturally, women are a lower social status than men, and that is a risk factor for several different stressors. And the female gender role encourages dependence and passivity, especially as it relates to their relationships with men. There is a specific type of depression that affects women after they give birth, and this is called postpartum depression. Between 25 and 50% of women will experience a short period of what's called maternity blues or baby blues. This is a very mild depression, and it will last between 1 and 2 days after childbirth. During this period, a person may just have episodes of crying, more fitful sleep, tension, anger, and irritability. And this is part of the normal adjustment to childbirth. After giving birth, the woman's hormones kind of go all over the place, and it makes it really difficult for her to adjust. But that if it doesn't just resolve itself within a few days, it can be classified as postpartum depression. And this can be mild to moderately severe depression that begins within the first 3 months after giving birth. This can result in an inability to cope with the new baby, feelings of inadequacy, mood swings, and an increased risk of self-harm. And this can last anywhere from 2 months to 1 year. Oftentimes, women expect that when they give birth that like it's magical, and then they have this new baby and they love it so much, and that like motherhood just feels so natural to them. And yeah, they're tired and they're stressed out, but it's still a wonderful experience. And for some women, they don't get that wonderful feeling, and it makes them feel really inadequate, or the fact that they're taking care of this baby, and they're getting no sleep, and they're unable to take care of themselves and get any alone time, and the child's on them all the time. That can make them feel very resentful of the child. And it's good for parents and partners to support a woman after giving birth, but again, her hormones are kind of all over the place, and so therefore it just might be something that biologically just needs to be taken care of. OBGYNs, when they do the checkup with the mother after giving birth, usually around 6 weeks, they will usually ask about the woman's mental health, but sometimes they don't, or the mother may not be forthcoming with her answers, and they may miss it, and it can it can be treated either with medication, therapy, or just, more support, more sleep, better, periods of rest and food and things like that, getting outside. Um, but for some women, it can be very, very severe and can be longer lasting. There's also postpartum psychosis. That's when a woman may hurt herself or the child as part of a psychotic episode. They essentially just think that the world would be better off without me as this baby's mom. This baby would do better off without me, and they may hurt themselves. And they have been known to actually kill their babies. There's been some very famous cases where women have drowned their 4 children in a bathtub because they were so depressed and they went into this postpartum psychosis period. And obviously, that's awful and shouldn't have to happen. But that's why it's so important for women to have family support around them after they give birth. There's also a common type of depression called SAD. That stands for Seasonal Affective Disorder. That's a depression that occurs only during the fall and winter, and they believe it's due to the decreased exposure to sunlight. This happens more often in northern climates because, if you've ever lived up north in the winter, the sun starts setting at 3:30 in the afternoon, and when you do go outside, it's so cold, so you're bundled up, and maybe just a little bit of your face is kind of being exposed to the sun. And the sun that you do get is very weak. So people who are very sensitive to these things are very often, they go through a mild depressive period. They may sleep longer, they feel more tired and drowsy, they may become more sad, anxious, and irritable. It's more common for people who kind of had grown up in the South or spent long periods of time in the South and then they move back north. And one of the major treatments for this is called phototherapy. This is when a person gets themselves exposure to bright, full spectrum light. They can do this by going outside and spending more time outside, kind of, upping their vitamin D levels, whether that's through sunlight or a supplement. But for other people, you can actually get special full spectrum light bulbs, special lights, and you kind of have that shine on you for an hour or so a day. So, when they're reading a book or working on homework, it would actually shine onto their skin and it makes them feel better. If it's really necessary, they can see someone, a doctor about it, and they can be prescribed mood stabilizers. But generally speaking, just some basic changes to their lifestyle can make a big difference. And usually, again, will resolve in the spring. Another type of depressive disorder or mood disorder is bipolar and certain related disorders. So bipolar is major mood disturbances which involve periods of alternating depression with periods of mania. Mania is when a person is agitated, elated, and hyperactive. They will barely sleep. They either won't eat or they'll eat like crazy. They'll spend a lot of money. They'll be really impulsive. I heard of someone who, they just go on a road trip across the country, or they may steal, they might shoplift. I know one person who bought a car for a stranger, in a period of a manic episode. And so while they feel very good and it's very pleasurable to be in this period, then usually as that wears off, they then will enter a depressive period. If you've seen the show Shameless, one of the characters two of the characters, Monica, the mother, and then Ian, the son, they both have bipolar depression, and you can see how much it affects them. So bipolar disorders are considered to be cyclothymic disorders, but this is a less severe but more chronic form of bipolar disorder. In cyclothymic disorder, the person alternates between milder periods of mania and more moderate depression periods for at least 2 years. This person will function reasonably well during the mild mania, but they can become more impaired during the depressive period. So some people, they'll be more kind of on the manic side, or some people will be more on the depressive side. And this is where we get to the 2 major types of bipolar disorder. Bipolar disorder 1, or bipolar 1, is a mood disorder in which a person experiences a period of mania with also some very deep depressions. And then bipolar 2 is when the person is mostly depressed, but then has 1 or more episodes of mild mania. So we see bipolar 1, which is much more high on the mania with these like very deep troughs of depression. But then bipolar 2, which is mild mania with just mostly depression kind of interspersed with mild mania periods. So where do these things come from? These disorders, again, genetics. There is a genetic component to this. Changes in neurotransmitters. I'm sure you've seen the commercials that talk about, taking Prozac that will, balance your neurotransmitters, or it's just brain chemistry. And that is part of it. We do see that as a very effective treatment, but it's most effective when it's paired with continuous counseling support from a licensed mental health counselor or psychologist. Stress hormones do play a role in that. An individual's brain structures can play a role in their development of a mood disorder. Psychological factors and sociocultural factors, just as we explained as when we talked about how women are at higher risk. Related, but or not related, but often paired or comorbid with mood disorders are anxiety disorders. But we'll also be talking about trauma disorders and obsessive compulsive and other related disorders. So we're going to be going through all the disorders that are listed here on the slide. So anxiety disorders are disruptive feelings of fear, apprehension, or anxiety, and then they have distortions in behavior that are directly anxiety related. So the person will change their lifestyle to manage their anxiety or their feelings of fear and apprehension. One of the common types is obsessive compulsive and other related disorders. So OCD is probably what you've heard of this referred to before. That's a extreme preoccupation with certain thoughts and compulsive performances of certain behaviors. So with the obsessive part, they obsess. They have these extreme preoccupations over certain things. So we stereotypically think of that as cleaning and organizing. And then the compulsive part is what's really important. So a lot of people have obsessions that they really will focus on, things that have to be very clean and orderly in order for them to feel their best. But the compulsive part is where it gets diagnosable. And that's when a person will feel extreme stress. They get nauseous, they get sweaty, they just feel awful. They may feel like something terrible is going to happen if they don't actually complete the behavior that they think will then manage the obsession. So the compulsive management of the obsessions is what makes OCD. There's an excellent TED Ed video available to you guys, as well as like a day in the life of a person with OCD. And then we also have in this category of trauma and stress-related disorders, and that's behavior patterns brought on by traumatic stress, PTSD being the most common. So with generalized anxiety disorder, we have that it's a chronic state of tension and worry about work, relationships, ability, or impending disaster. And this has to continue for 6 months or more in order to be diagnosed. Individuals will often complain of sweating, having a racing heart, clammy hands, dizziness, and an upset stomach when they're feeling anxious. Their mind just kind of overworks and can't relax and can't release certain thoughts. It does affect women more often than men, but it doesn't involve panic attacks. That's a separate disorder called panic disorder. For people who have panic disorder, this is a chronic state of anxiety with brief moments of sudden and intense and unexpected panic. And they may have a panic attack. This is when they have chest pain, a racing heart, dizziness, choking, feelings of unreality, trembling, or fears of losing control. Individuals going through a panic attack will often report feeling like they're having a heart attack, that they're going insane, or that they're about to die. They almost feel like they're drowning because they can't get a breath and they can't take in air. And obviously that's terrifying. Also related to anxiety disorders is agoraphobia. This is a fear that something extremely embarrassing will happen if the person leaves the house or they enter an unfamiliar situation. So typically they won't leave wherever they're comfortable, whether it's their house or their room or their small neighborhood. They will oftentimes fear an attack of dizziness, diarrhea, or having a panic attack, and leaving the house or again their safe space becomes extremely terrifying for them. And they can also suffer from panic attacks. Specific phobias are just intense, irrational fears of specific objects, activities, and situations. The person may fully understand that their phobia is not necessary. So feeling, terrified of frogs. Like they understand a frog's not going to jump out and kill them and eat them. But they just are terrified of them. So there's very common phobias such as arachnophobia, which is a fear of spiders, acrophobia, which is the fear of heights, aviophobia, which is fear of airplanes, and then the triskaidekaphobia, I don't even want to say that. That's fear of the number 13. Xenophobia is a fear of strangers, and then I'm not even going to attempt the fear of peanut butter sticking to the roof of your mouth. Now, the most common fear is public speaking, which I'm sure some of you guys have felt. But for people who have these phobias, it really affects how they live their lives. People who have aviophobia will not be able to go on airplanes. And there are treatments. They oftentimes will use systematic desensitization, as we talked about in chapter 6. They are now using techniques such as virtual reality to kind of expose them to what it would be like to go through an airport, sit on an airplane, go through takeoff and landing. But eventually, if they're going through treatment, they actually just have to go and kind of face that fear. So here's some common ones. I actually took this picture here of, this is in an elevator at a hotel I stayed in Orlando. And you can see the numbers go 8, 9, 10, 11, 12, 15. Like they skip 13 and 14. Because you'll see this on airplanes too. If you're counting the aisles or the rows in the aisle, it'll go from 11, 12, skips 13 and goes straight to 14. It just cracks me up every time. It's like they just pander to people with the fear of the number 13. I know this is a new one. I forget what it's called, but it's like fear of little holes that are tightly clustered. Obviously, fear of spiders, fear of snakes. Those are also very common. Some people have social phobia. This is an intense and irrational fear of being observed, evaluated, embarrassed, or humiliated by other people in social situations. They may fear public speaking. They may fear eating in public. And this can impair their ability to maintain a normal lifestyle. Being in public becomes or around other people becomes very scary, and it that makes things like the first day of school or eating lunch with other people very, very overwhelming and difficult to deal with. So when we look at specific phobias and social anxiety disorder, people are very, the different types of phobias, males and females. So situations are more common for females, same with animals. Injuries about equal. And then people who have at least one phobia, and again, it's higher for women, and who have more than one phobia, higher for women. And again, it has to last for 6 months or longer in order for it to be diagnosable. Again, OCD, we're going to go back into this, is an extreme preoccupation with certain thoughts and compulsive performance of certain behaviors. So they may have an obsession that things are dirty or unclean, and then they have to perform an action in order to relieve that anxiety. So they might have to lock a door a bunch of times before they feel like it's correct. They might have to put things into order. And interestingly enough, hoarding disorder is actually a type of OCD. And now you think of hoarding as, extreme messiness and just collection of just nasty stuff. But they have this obsessive tendency to collect items. And then if they were to throw away anything, it causes them this extreme stress. So they continue to hoard and hold on to things. And that's how it's connected with anxiety disorders and OCD. But these obsessions give rise to compulsions, and that's when they feel this irrational need to perform an action they have to repeat over and over again until it feels correct. Again, hoarding disorder is characterized by a persistent difficulty in discarding possessions in a way that they accumulate and they clutter living areas, and that can cause a person significant distress and impairment of functioning. Their houses will be so cluttered and so gross that, they'll have dead animals and like feces all over the floor. They can't use their bathrooms and they can't function, but yet they can't get themselves to throw anything away because there's a fear that they may need it later on. If you've seen like the shows on hoarders on like TLC and in other places on TV, usually a psychologist will go in and talk to the person for a little while, and they just start throwing away their stuff, and they'll walk them through a handful of items, and they show that anxiety arises. But then if just a team comes in, shovels out their house, and then they put the person back in the house, like, okay, you're cured now, you're all set, like your house is ready to go. And they don't show the check-ins like 6 months, a year later, because generally these people will have reestablished their hoarding collection because you actually haven't solved the problem. You've just erased it for a short period of time, but they're going to go right back to those behaviors because you actually haven't help the underlying condition at all. Post-traumatic stress disorder, also known as PTSD, results from an exposure to a traumatic event during which the person will feel helplessness or fear. This can happen from a variety of different causes, from a violent personal assault such as rape, physical abuse, sexual abuse. Could be something like a car accident, a natural or human-caused disaster such as an earthquake, hurricane, terrorist attack, or outbreak of infectious diseases. Military combat is what we, I think, stereotypically think of as causing PTSD. So a lot of our veterans who have done active service duty, they'll come back with PTSD symptoms. So this person, so it can be caused by any event that a person witnesses or experiences. And oftentimes they'll have nightmares, they'll have different things that trigger them. So whether it's a smell or a sound or some visual stimulus that kind of puts them back into that moment of the trauma. It's called a flashback. They may go through depression. They will have compensatory strategies to avoid things that may trigger them. They may use drugs and alcohol to self-medicate. And it really hasn't been understood well until very recently. It used to be called shell shock when people came back from war and they just weren't themselves anymore. And they had higher rates of alcoholism and spousal abuse. They would call it shell shock. But today we know it as PTSD. Now, there's antidepressants, of course, that can help with this. There's different talk therapies. One of the things that they're finding out is really interesting is that, especially during military combat, if an individual has gone through this traumatic experience, oftentimes, of course, they're doing these missions that are 24 or 48 hours where they're not sleeping. And oftentimes when they get back after this traumatic event, they just want to go lay down and fall asleep. But as we know, with sleep, it consolidates memories. So oftentimes if they can keep them awake for another 6 to 12 hours, it allows that memory trace to fade instead of being consolidated. And it can disrupt that pattern of memory and makes PTSD less likely to occur later on. But obviously that's more of a preventative strategy. Also, there's different types of therapies where they have them go through the traumatic event, and they have them do it in all the different senses. So what did you smell? What did you hear? What did you feel? What did you taste? What did you see? And they have them go through in excruciating detail, second by second, and that will allow their brain to kind of take it from being internal to external, and that seems to help some individuals. Not everyone, but they're getting better at treating this. But individuals who maybe can recognize their traumatic event, they can kind of manage their lifestyle as best they can to avoid being triggered and manage their stress and their sleep and all the different things that can help your mood. So with the prevalence of anxiety disorders, it's actually quite common. It's about 20% for any anxiety disorder, but the most common ones are phobias and social anxiety disorder. As you can see, the rest of them are pretty low. And we're going to pause here, and we'll start on the last section in just a moment.